Hello, everyone. My name is Elina Tochilnikova, and I'll be presenting on behalf of our team from Northeastern University. Our talk is titled Guilty of Talking Too Much, How Psychotherapists Gamify Therapy. Our study was driven by two identified problems: the limitations of in-person therapy and the fact that traditionally game designers have driven the development process of psychotherapeutic games, with psychotherapists playing a consultant role. We offer an alternative. We have psychotherapists design their own digital gamified therapy with the prompt of anxiety disorder. The prevalence of mental illness is increasing both nationally in the United States and globally. With the advent of COVID, rates of mental illness have risen as well. Our content analysis identified an important narrative that likely digital gamified psychotherapy will complement standard treatment as opposed to replacing it. There is a huge breadth of research on digital gamified therapy. Most current research explores gamification techniques in the context of psychotherapy, specifically levels, feedback, scoring, reward systems, and narrative. Here we see our methodological trajectory delimited step by step. During the first workshop, our participants were trained in Studycrafter, a user-friendly design platform for designing digital narrative games. For the second workshop, subjects completed their first gamified therapy prototype, and for the third workshop, they completed their final prototype. We recruited 7 psychotherapists with 2 to 35 years of clinical experience, specializing in different therapies. Our 7th participant, P7, left our study due to technological difficulties. Communication in between workshops was conducted based on participant needs. We conducted 3 consecutive 2-hour workshops over the course of 6 weeks via Zoom and aimed to answer the following questions. What can we learn about gamified psychotherapy from the creations of psychotherapists? What do psychotherapists think about the potential of gamifying psychotherapy? What do they think of being the ones in charge of designing this kind of therapy? Our content analysis included game design analysis and psychotherapeutic analysis. Game design analysis used video recordings of workshops and their transcription to identify common themes and codes in the data. Psychotherapeutic analysis included collecting psychotherapists' gamified therapies and identifying their therapeutic approach: cognitive behavioral therapy, dialectical behavioral therapy. Thematic findings from the game design perspective were iterated through a clinical psychotherapy perspective to connect specific clinical techniques used by therapists with themes found in thematic content analysis. Studycrafter is an online authoring tool to create, share, and play interactive projects in the form of digital games. And again, our participants used Studycrafter to curate their unique psychotherapy. Here we see examples of 3 participants' games. P1's game involved a character beginning to levitate as her anxiety rises. The player needs to choose the appropriate choices from different sets of possible responses in order to return her down to earth. The narrative is presented in a poetic, dramatic style with special effects of psychedelic visuals and music. P4's game revolves around 2 individuals exchanging dialogue in a home setting in which one is displeased with the other. The player must navigate through the dialogue and choose appropriate responses to resolve the conflict successfully. P6's game involves a baby floating in the sea, and the player is tasked with practicing breathing exercises that will return it to shore. The sound of gongs informs the player when the breathing exercise is complete and when the baby has been simultaneously returned to the shore. Hence, our psychotherapists created a diversity of games. We identified 4 classes of digital psychotherapy games. Educational, games that directly provide the player with information regarding anxiety and methods for treating thoughts and emotional states related to anxiety. Advocacy, games that have their characters express emotions that the player can relate to. Call to action, games that provide the player with instructions for exercises to resolve their anxiety. Hybrid, games that offer a combination of techniques and approaches. Therapy game techniques included cognitive behavioral therapy, dialectical behavioral therapy, diverting attention, removing uncertainty, and providing sensory feedback. Our study explores and supports the conclusion that psychotherapists can be designers and posits the possibility of patients being designers as well. It also explores ethical considerations, such as safety concerns, with having the public design their own games. Some participants became more fluent in Studycrafter than others, and those were the ones who were less fluent in Studycrafter were the ones who utilized the team for support between workshops more. Importantly, participants may have imitated design archetypes based on the games presented to them as examples prior to the introduction of Studycrafter during the first workshop. The author recruited participants through her professional network. Hence, there was self-selection and sampling bias. In this exploratory study, we investigated allowing psychotherapists to create their own unique gamified psychotherapies. From the psychotherapist designed artifacts, we extracted several genres for gamified therapy and game mechanics to facilitate therapeutic effects, which are insights helpful towards establishing principles for psychotherapeutic game design. More importantly, our work demonstrates that psychotherapists can be designers and that we can learn from how psychotherapists gamify their therapy. If provided with the right tools and support, the future of gamified psychotherapy may be co-created by psychotherapists. Thank you for listening.